Good morning, everyone. Thank you for joining us today. My name is Stephen Gitsoyan, and I am the Assistant Director of Alumni and Family Relations at Cal Lutheran. Before we get started, I just want to go over a few housekeeping items for this webinar. If you have any questions during Dr. Turner's presentation, please use the chat box feature in the Zoom menu. We will have dedicated time at the end of this presentation for Q&A. When you joined this meeting, your video was turned off and your microphone was muted. There's no need to change these settings during the presentation to help us avoid any excess noise or disruptions. Finally, this presentation is being recorded, so it will be posted on our website and sent to you after this presentation for your reference. Now, it is my pleasure to introduce our presenter for this morning. Dr. Beth Turner is the Interim Director of Counseling and Psychological Services at Cal Lutheran and a licensed psychologist. She specializes in treating anxiety disorders through evidence-based practices. She is also a wife, bunny mom, gardener, and a board game enthusiast. So with that, I will turn it over to you, Beth.
Thank you so much, Stephen. I'm really excited to be here today. I have to admit, I really enjoy public speaking and doing presentations, but this is my first time doing one through more of a live webinar format. So I am slightly nervous, I guess, just because it is a little different. But I'm happy to be here and to talk a little bit more about how to cope during the coronavirus. And thank you, Stephen, for helping field questions, and I'll go ahead and have you advance to the next slide. So coming up with a title for this presentation, more along the lines of what I was thinking about, was way too long of a title for us to be able to promote. But really, I want us to be able to frame everything that's happening now and have a better understanding of the stressors that are going on, the stress response for us, specific mental health concerns. I will review a little bit of the literature that's been done on how mental health and psychology are impacted during quarantine and circumstances that we find ourselves in right now. And then ultimately, I want to give a lot of coping skills. So I think a lot of us kind of have an understanding of how we're doing at this point now that we've been a few weeks in to the COVID-19 pandemic. And so I want to leave us all with a lot of different skills that we can be using as we move forward. You'll see throughout the webinar that I have a lot of, memes or different kinds of amusing or funny kinds of pictures. I'll admit that that's my own, personal. I like to lean more towards humor when I'm stressed, and that's one of my big coping factors. So there's a lot of them in there. Hopefully they give you a little bit of a chuckle. So first, going into living during the COVID-19 pandemic, this is a global pandemic, and so there are a lot of mental health implications. I think a lot of us are very aware of the physical implications, a lot of the precautions that are put in place, a lot of the health issues that people need to be aware of. But I think sometimes it's also really important to look at how this is taking a toll on us mentally. And so some of the larger pictures of what's going on and how it's impacting us, first is what we're calling pandemic panic. So there's this overall anxiety and worry that a lot of people are feeling that comes with any type of pandemic. And there's been research looking at how this affects us going back to SARS, Ebola virus, H1N1, MERS. And so there's a lot of anxiety, uncertainty. There's the toilet paper is disappearing, flour and yeast are disappearing. So there's a lot of changes in our daily functioning. Doing the stay-at-home orders or the social distancing orders can create a lot of feelings of social isolation for people as well. And you might have noticed that just not being able to see your coworkers or family members or friends, especially not in person. It can feel weird. I think there's this sentiment of aimlessness that a lot of people are feeling. And for a lot of us, it's just a major disruption, right? So if some people have unfortunately lost their jobs, we're also looking at very real grief and loss in terms of people who have COVID-19, and unfortunately, if we lose people to that too. And then there's for others of us, it's, not being able to go through our daily routine, even getting set up to work at home. I'm grateful that I can work from home, but that's been a big challenge as well, transitioning for that. And so when we look at kind of this larger picture and all the major disruptions and changes and transitions that we're having to go through, there's some large pictures for a pandemic that have a big influence on our mental health. So one of those is the duration, and I think that ties in with the uncertainty that we're feeling right now. The longer the duration, the more we see mental health implications for people. There's also a very real fear of infection. And there can be a lot of stigma for people who get infected, know people who are infected, especially, we've seen this more racist kind of rhetoric around coming from China, as opposed to seeing it as a global viral pandemic that's happening. Additionally, we're in the United States, we are seeing different kinds of messages based on which state or city or local ordinances that we're following. And so getting different information, confusing information, inadequate or not thorough information can absolutely have a really big toll on our mental health. There's also worry around basic supplies, like I said, toilet paper, yeast and flour, hand sanitizer, those kinds of things. And then there's a lot of frustration and boredom that can come up for people, feeling, kind of anxious, restless, aimless while we go through this process. So if you can move to the next slide, what all of that translates to is a lot of mental health symptoms. And so there's a really great article published by The Lancet that looks at a lot of scientific research, and through their rapid review of the evidence, the psychological impacts of quarantine, that was put out in February of this year. And they reviewed 24 scientific articles in kind of a meta-analysis style, and looked at, like I said, there's SARS, Ebola, H1N1, MERS, and they looked at all the studies that have been published on people who had been put in quarantine. And so, you can see on the screen, there's a really long list of the emotional and cognitive impacts that we see from living under quarantine. So most of these studies did look at people who were forced to quarantine or self-isolate because they themselves were infected. But I think we're also seeing some growing evidence, because this is newer in terms of the large scale stay-at-home kind of self-quarantining orders that we're going through. There's worry, irritability, fear, frustration, that boredom piece or aimlessness piece. Anger is really, really common. For some people, there's a sense of numbness or detachment, so emotionally kind of distancing and feeling out of touch with kind of how we're feeling and what we're thinking in this process. And then there's a very real grief component, and I'll get into that in a little bit as well. And we see really big impacts on sleep. So for people who are really kind of hyped up, feeling this really strong anxiety or depressive kind of response, that has a really big impact on our appetite and on our sleep habits. And I know that my sleep's kind of been thrown all over the place and getting set back into a regular schedule. There can be a sense of confusion, also a sense of guilt. There's, what we call survivor's guilt. So if we perhaps are okay, but we know other people who are being impacted greater or have been tested positive, there can be guilt around that, and maybe thinking about what did I do or didn't do that I would want to change. There's also some guilt when we do a lot of social comparison. So thinking, well, I have it better than this person or these circumstances, and that can lead to a lot of feelings of guilt. There can be that sense of social detachment, and I think we're seeing that more as we move into more of the social distancing precautions. There's also this really deep exhaustion. Physically, I'll talk about that in frames of grief and loss. But, when we're really, really high anxiety and we have all of this stuff going on, eventually our body can't sustain that. And so eventually that exhaustion will come in, we'll start to feel a little lower, and that'll be lower mood, lower energy. We've really depleted a lot of our emotional energy while we navigate a lot of this uncertainty. And then we see a lot of cognitive or thinking-based kinds of traits that come out of living in quarantine. So poor concentration, and I know a lot of people that I've talked to, there's a lot of distractions and getting used to that as well. But just living in these kinds of circumstances, it can be hard to focus, it can be hard to concentrate, there's a lot of stuff on our minds. And when we're really emotional or overwhelmed or in a lot of worry, there's a lot of indecisiveness. So when we have really high levels of emotional responses, that literally shuts down the higher functioning or logical parts of our brain. And so, you know, on a normal kind of day, if you're generally mentally pretty well and healthy, you know, you might not think much about, you know, what you're choosing to eat for breakfast or what kind of shirt you're going to wear. But those things might feel really, really hard to do right now. We also see, so especially when the studies have looked at people who are coming out of the quarantine phase, and this is something that we might notice more of as we move more towards the end of this, is a lot of people feeling very hypersensitive to health. And I know a lot of people are feeling that right now, you know, taking your temperature regularly, being, you know, really cautious if you find yourself coughing or showing different signs or symptoms. But we also see that once people are able to start to return to what's more of a normal kind of life experience, we do see an increase in people who may avoid or feel very sensitive around large crowds, being close to other people, especially knowing that maybe they're ill. And then finally, we also see a reluctance to go back to work for a lot of people, and a reluctance to work right now too. I mean, there's a lot going on. So with all of that said, we also want to house this in the framework of what's called in psychology the biopsychosocial model. So right now, the major stressor for most people is the environment, and that really, you know, encapsulates every single part of our lives. We're not immune to that, and that has a really big effect on our mind, body, and the mood, so the thoughts and the emotions, as well as how we act, our behaviors. And so all of these things are interconnected within us, and you might notice if you've been to therapy before, or if you're really insightful and take time to reflect on how you're doing, you might notice that, you know, certain emotions bring up certain thoughts, cause significant body or physical reactions, and then can influence our behavior. And so, you know, for example, if you're feeling anxious, like I said this morning, I'm not used to hosting more of a webinar kind of style presentation. So I was feeling kind of nervous, and then, you know, thought-wise, it's like, I hope this goes well. And then, you know, impact on body, you know, my stomach was a little upset, there was some muscle tension, there's a little bit of jitteriness with the adrenaline. And so behavior, you know, knowing what to do in these circumstances and, you know, talking about it later in this presentation, I knew to take some deep breaths to try to help with that. But if I didn't know what to do, you know, maybe my behavior would lead to pacing or, you know, reaching out to a person for support, those kinds of things. So having this kind of understanding is really, really helpful because it also can show us how to cope. And so with all of these different entrance points that are interconnected, we can choose one that fits us the best or that we're most receptive to. So if you're much more in tune with your emotions or your body, then that might be a really good starting place for you to implement a lot of these coping strategies. So one of the things we can do is look at the literature on resiliency. So resiliency is the idea that we can overcome hardship. Struggle is a part of human life, and trauma is a part of human life. And we're able to grow and build skills to be able to work through these. And ultimately, that helps us become stronger, more adaptive, and more resilient. I like to think of reframing the social distancing piece to physical distancing because, you know, we don't want to be socially distant. And that's one of the biggest things that we need to work on to improve our resiliency. And so building connections is really, really important. We want to prioritize relationships that we already have. If we don't really have a lot of very strong or supportive relationships, we can look at joining different groups. There's a lot of different organizations to get involved in. If you're joining as an alumni or, someone affiliated with Cal Lutheran, there might be groups there for you to feel like you have a sense of belonging and gain some support there. The biggest thing we want to focus on when we're building connections and honing in on those connections is making sure that those people are understanding, supportive, and not judgmental. So they're there to really uplift us. We also want to foster a sense of wellness. So we need to look at the body. How am I sleeping? How am I eating? Am I staying hydrated? Am I physically moving or getting some sort of exercise? Am I taking medications that I need to take? All of those are going to be really important for our body self-care. We also need to be really mindful, and I'll walk you through that in the next slide of how to practice mindfulness if you're unfamiliar with that. And the last thing we want to do to foster wellness is to be aware of more of the maybe maladaptive or less helpful things that we might be drawn to do to cope. So it's been all over the news, alcohol sales have been up. And so, watching, are you being drawn to something that may ultimately have a greater negative impact on your health and trying to refrain or limit those? We want to find purpose to build resiliency, and being proactive can be a really important stage in finding purpose. So checking in with yourself, what's important, what values do you hold and want to align with, what drives you, what kinds of goals do you have in life, how do you want to contribute to society, to your communities that you're a part of. Helping other people can be a really big way of finding purpose, and there's a lot of ways to do that right now. If you're financially able to donate to food banks, or if you're able to reach out and offer support to maybe someone that is struggling, or just checking in with people, whatever it is that feels more natural and gives you that sense of purpose in helping other people. And then what can also help us develop a sense of purpose is self-discovery. So taking time to be, reflecting, gain that insight into who you are, what matters to you, what drives you, what are your passions. We also want to embrace healthy thoughts. Gaining perspective is a really, really important part of building resiliency. It's really hard to gain perspective right now because no one has a definitive end date. And, we're also talking about preparing for a wave 2 in the future as well. So with all of that uncertainty, it can be hard to gain perspective, but just reminding yourself this is temporary. Things will change. They are already changing since this has started. Accepting change is a major facet in this, and mindfulness can help us with accepting what's going on. Building a sense of hopefulness, so finding some sort of optimism, bright lights, silver linings, whatever it is that helps you kind of see more into the future and be more future oriented is going to be important. And we also want to learn from the past. And so maybe, if you've experienced or suffered through, major trauma or major disruptions in your life, you might be able to draw from those moments and how you were able to move through those and make meaning into this one now. So moving into more specific coping skills, this is what I really want to spend a lot of time kind of going through and giving you all examples on how to take care of yourself in a lot of different ways right now. One of the most important things we can do is practice mindfulness. I had a supervisor years ago that explained mindfulness to me as a small child who's walking through a field. So usually when we're going through our day-to-day lives, we get set on autopilot. Mindfulness is a really good practice to be very intentional in taking in our surroundings, what's going on for ourselves, our thoughts, feelings, what's happening in our body, and being just really curious about it. And so this example of a kid walking through the field, for some of us, it might be, I just need to go from point A to point B. For practicing mindfulness and doing that, you might notice like, oh, look at these flowers over here. There's a butterfly flying through. There's a patch of mud over there. And so really practicing kind of checking in. Maybe do that for a second for yourself right now. What emotions are you noticing? What kinds of thoughts are coming up with that? And physically, are there certain sensations in your body that you're feeling right now? And that moves me into my second point, which is acknowledging grief. For a lot of us, there's a lot of worry, anxiety, feeling overwhelmed with what's happening. A lot of the discomfort that we're feeling can be named as a grieving process. And that can be really important for us to name, recognize, and move through. There's a lot of anticipatory grief that we're feeling. And so some of the major people in the psychology field, Kubler-Ross and Kessler, have done a lot of research on grief. And so they've compared what we're going through now in explaining anticipatory grief more of maybe like what was 9/11. And so thinking about things are going to be different and are going to change moving forward. It's going to impact our society and the ways that we practice a lot of the things that we go through day to day. You know, going through an airport now is a lot different than before 9/11. So there's that anticipatory grief. There's also the 5 stages of grief. These are not linear. We move through them at different rates, and, you know, we can shift back and forth between them. But there's denial, and a lot of us, it was like, oh, I'm not going to be infected. This isn't a big deal. There's anger. You know, I'm being forced to work from home. You know, I lost my job. You know, there's a lot of anger around a lot of changes that we're having to deal with. There's the bargaining piece. Okay, we'll social distance for a month. Everything will be fine. And then there's the depression phase of grief, and that's just really heavy sadness. We also know that there's a lot of physical pain that comes with grieving as well. So when we grieve, we have higher levels of stress hormones. We see an increase in inflammation in the body that can cause a lot of different kind of joint or muscle aches or pain. There's also broken heart syndrome. And knowing that, you know, our changes in blood flow, oxygen, heart rate can all be impacted by grief and can leave a lot of physical sensations that are uncomfortable. Eventually, moving through grief, we will get into acceptance and making meaning. And for right now, if you are moving more into these stages, it might be more of a sense of, what do I have control over? You know, I can wash my hands, I can do these different things, and practicing those can bring a sense of acceptance. Stimulus control is really important. I recognize I'm running low on time, so I'm trying not to rush this too much. But stimulus control, you know, make sure you're monitoring the amount of news intake that you're exposing yourself to. You know, if you're keeping an eye on the news, make sure you're balancing it out with some more positive things. You know, find some funny memes, find some really positive pieces in the news. That can be really helpful. Emotion regulation is really important if we're being emotionally flooded, especially with anxiety. There's some really, really good coping skills in emotion regulation. And one is activating the dive reflex. So if we're having really high levels of anxiety or we're really emotionally dysregulated, by submersing your face in a bowl of ice water, I know that sounds really terrible, but that activates the dive reflex, and that's a mammalian reflex that causes us to hold our breath and prepare for being submerged in the water. And that also, the biggest thing for helping our emotions is it decreases our heart rate. And so when we see a decrease in heart rate, that literally does not, it moves the emotions down too. And so reduced heart rate doesn't allow us to have such high levels of anxiety. We can also get the same kind of effect by splashing cold water on our face too. We also have, you know, physical exercise, slow breathing, deep breathing. So breathing out slightly longer than you're breathing in activates the relaxation response in our body. Behavioral activation is also really important. So these are things, if you're starting to feel more in that slump, more depressed, more low, we want to move our body. We want to make sure we're getting out of bed, you know, practicing our hygienic practices like showering, brushing our teeth, getting dressed, going outside, you know, moving your body around is really important. Therapeutic touch refers to us, again, as mammals, we respond really well to a sense of warmth and slight pressure. And so sometimes we even find ourselves grasping our hands or putting a hand on our chest when we feel a really big surge of emotion. And that's our own way of engaging in therapeutic touch. We do have the vagus nerve that runs through our central nervous system, and a big part of it is over our breastbone. And so placing a hand over your heart can be a really good way of providing yourself some therapeutic touch right now. Giving, receiving is a really good practice for, again, kind of engaging in a sense of purpose and practicing gratitude for what we do have and what we are able to give. What we do know about practicing gratitude is even just one thought of one person or one circumstance that you're grateful for right now can increase your sense of happiness immediately. Practicing gratitude and self-compassion also increases our levels of oxytocin, which helps us feel better. It also increases our sense of trust. So these are things that we can do. Self-compassion is generally described as treating yourself the way you would a loved one. Usually we're very, very self-critical, unwarranted in a lot of instances. And so maybe reframing and thinking, you know, what would I tell a loved one right now? How would I reassure them? How would I be there for them? And then practicing that for yourself. And some people think that maybe that feels selfish, but actually when we practice self-compassion, it helps build our ability to be more compassionate towards others as well, on top of monitoring and managing our own emotions. So there's a lot of different skills I threw at you right there. Sometimes we also just need a break from stuff. And so there's a lot of good opportunities that are happening right now. I just put a few ideas on the screen to maybe help you think about things that you might want to engage in if you want to explore, in a certain sense, things that are going on right now. Lastly, one of the parts of building resiliency is knowing when to seek help. We do have 211 from landlines or clicking on 211.org to find resources that we might need right now. The Substance Abuse and Mental Health Association has put out a disaster distress helpline. So if you have specific worries about COVID-19 and you need to call someone on a helpline about that, that is available. At CAPS, we do have resources on our webpage, and you can find that on the screen. If you know of a student who might be struggling right now, there's also the care team that's available, and you can submit a report about a student that you may be worried about, who could use some additional reaching out, support, and resources. Lastly, engaging in therapy. At CAPS, we've moved all of our sessions to teletherapy over video or phone. A lot of therapists are doing that right now. I encourage you to go through your health insurance, or there's a couple of other websites on this slide to help you find a therapist if that's something that you're needing or wanting right now. Open Path Collective at the bottom is sliding scale, so if you don't have health insurance or don't have health insurance that gives you the coverage you need, Open Path Collective offers $30 to $60 sessions based on your financial need. So there's a lot of information there. Thank you so much for sitting in and being a part of this. And if we have time for questions, I'm more than happy to answer those.
Absolutely. Thank you, Beth, for taking the time and sharing all those coping skills with everyone. I do want to open it up to questions right now. If you have any questions, please use that chat dialog box in the Zoom menu. You can put your questions in there, and then I will field them through Beth. We did have one question come in, but it looks like you answered it with all those coping skills. It was specifically focused around the feeling of guilt and having a job and income hasn't changed right now. What specific coping mechanisms to deal with that feeling? But looks like Nancy followed up and said you had answered those questions, but I don't know if you have anything else to add, Beth, to that specifically around the feeling of guilt.
Yeah, guilt's a really powerful emotion. I think a lot of times we try to avoid it or change it. But that's a part of really good mindfulness practice, is to acknowledge it. There's helpful guilt, that maybe there's something that you can be learning from or working on for yourself. And then there's also unproductive guilt, right? And so are you just sitting in a sense of self-blame or, feeling bad? And I would encourage you, if that's something that you're struggling with, is to focus more on what is within your control right now and be able to just try to accept that sense of guilt, that's normal for a lot of people.
Great. Thank you, Beth. There's another question that came in about younger children and helping them manage anxiety during this time.
Yeah, if you Google, there are some really good guides on how to talk to kids of different ages about what's going on. I mean, it really depends on the age range for them to be able to understand and capture, you know, what exactly is happening right now. A lot of these anxiety and emotion regulation techniques that I went over, kids are really, really receptive to and can benefit just the same from them. Going over and talking about what are normal, you know, physical sensations of different emotions can then help your kid develop that awareness and understand internally, you know, what is going on for them, and then giving them some resources or some tools to use that. There's some really great, again, if you Google, there's like, you know, yoga poses for kids, teaching them some deep breathing, teaching them gratitude exercises. The behavioral activation can be especially helpful. A lot of times in kids, depression and anxiety can come up as boredom, frustration, and irritation. And so know that those might be signs to look for and help your child with.
Great. Another question, someone who knows someone who is in the hospital right now with COVID-19, who can't see any visitors, but they want some ideas on ways to show support to them and their family. Any suggestions on supporting those that are maybe affected by the disease during this time?
Yeah, that is really tough. And I think, again, when we're talking about this grieving process, there's that anticipatory grief that we might be feeling for people who have tested positive or show signs. And, you know, we're really restricted right now because, you know, like you said, we can't visit them in the same way. And I know people who have lost people, the services afterward are lacking or are very different. I've seen a lot of really creative ideas for people who've been able to visit or find ways to show support. So if someone is on a first floor and has a window, you know, I've seen people making signs and, you know, kind of showing up outside the window or the door and being able to talk from a distance like that. Phone call, you know, I'm glad that we have the technology to be able to have phone calls, to be able to video chat with people. Good old-fashioned letter writing and cards can be really powerful right now. And, you know, maybe even if the person in the hospital has access to a smartphone, you know, maybe even having handwritten cards that you take pictures of and send to them. When we're talking about someone else who's maybe a little distant from us in terms of our social circles or our relationships, so if this is another family, we also want to be really respectful of their grieving process too. And so make sure that, you know, if you're not directly involved or have a direct relationship there, try not to insert yourself too much. You know, a lot of people are going through their own process. So I always recommend that you check in with people and say, you know, I'm here for you. I want to support you. Please let me know what you need or if there's anything that I can be doing. Just those sentiments can be really powerful. And I'll end that, especially with the grief part. There is a website, grief.com, and they have a lot of resources on what to say, what not to say, understanding the stages of grief. And right now they do have a pop-up group for people who are grieving every day. And so I really recommend you go to that website and check out a lot of resources there too.
Thank you, Beth. One last question, and then we'll probably be at time. They are asking you to review one more time that example of submerging your face in ice water as a way to help regulate your emotions. Maybe a little bit more on that, or other ways to help regulate emotions during this time?
Okay, absolutely. So the dive reflex, we use this a lot in psychology for people who need help regulating emotions, but I think a lot of us are here right now and need to use it. So in mammals, we've developed what's called the dive reflex, and this is evolutionary. You know, it goes back to having to survive in a lot of ocean or water type environments. And so because we have lungs that don't operate underwater, there's nerves around our face that get activated when we have cold water. And so when it's called the dive reflex because it's usually activated when we're submerged in cold water. Those nerves get that information and then they send signals to the brain and the heart. And those include decreasing heart rate and pulling a lot of the blood to the vital organs. and sending responses to the brain to go more into kind of a survival mode. And so when we're in that kind of situation, we literally don't have the capacity to experience strong emotions anymore. And so that's how that works. And you can get a similar effect by splashing some cold water on your face. And a lot of people find that helpful. If you want to do the full deal, get a bowl, fill it with cold water and put ice in it and submerge down through your cheekbones for at least 30 seconds. Some other emotion regulation tips. Like I said, deep breathing, breathing out slightly longer than you're breathing in. Some people pace it through counting, or there's a lot of breathing gifs you can find online. There's something called progressive muscle relaxation, and you can find a lot of these examples through a guided meditation. But progressive muscle relaxation, essentially when we're anxious, we tense our muscles. And so when we alternate different muscle groups, tensing them and then spending a few seconds relaxing them, that helps our body engage in the relaxation response as well. And lastly, I'll add, if you're more of a cognitive thought-based kind of person, because a lot of those are very physical, there's something called wise mind that can be really helpful. And so making sure that you're looking at a balanced approach. So you're acknowledging your emotional reaction and then also looking at the logic. What are the facts here? And how can I make use of that information and make decisions based on that? And something really powerful can be thought or emotion distancing. So a lot of times we might tell ourselves, I'm really anxious. Technically, we are not anxiety. And so something that can be really helpful is for us to distance by saying, I am feeling anxious right now. And then a lot of times that helps us feel mentally like we have some space to be able to make decisions and cope with those emotions that we're feeling.
Great examples. Thank you for sharing, Beth. We are at time, so I want to be respectful of everyone's schedule today. So I want to extend a huge thank you to Dr. Beth Turner for taking the time this morning to present and share some really valuable insights into what we're all feeling right now and some coping mechanisms to help us get through this time. I do want to just note a quick save the date for next week's presentation. Dr. Stacey Thayer presenting on effective management of remote teams, since a lot of us are, working from home and seeing a new reality in our management and teams and work schedule. That should be a really insightful presentation there. So again, thank you very much, Dr. Turner, for taking the time this morning. Thank you for everyone that joined us. Stay safe, stay healthy, and be sure to check in with each other during this time. So take care, and we will see you all next week.
Thanks, everyone.